it's Caitlin. So for this video, we're going to be going through a patient assessment or management for trauma. So we'll go ahead and get started. And I'm pretty sure, since we don't have the equipment stuff and I don't really have a person to demonstrate it on, I'll just be explaining it. I hope that's what I'm supposed to do. But yeah. So first things first, you start with the scene size up. Just determine that the scene is safe and go ahead and just kind of take and verbalize any sort of precautions that you're going to be taking. Also determine the mechanism of injury. For example, if they got hit with a baseball bat, you're going to say patient is unconscious because they got hit with a baseball bat. Anyways, also you're going to determine the number of patients and request any additional help if necessary, for an example like ALS or some other sort of advanced medical personnel. Also, generally you'll consider stabilization of the cervical spine or just rule out any trauma that could be occurring. Sorry, it's my dog in the background drinking water. Anyways, after that, you're going to go through a primary assessment and verbalize the general impression of the patient, such as their age, sex, and race. And then if they're conscious, you're going to introduce yourself to them and get their consent to treat them. And dang, he's thirsty. And the next thing you're going to do is determine their chief complaint and determine any apparent life threats that are going on. Also, if they're not conscious, it's going to be a little bit more difficult because they're not going to be able to tell you exactly what's going on. But the way that you'll determine this and their level of consciousness is through AVPU, which is basically just a rating of how alert they are and how conscious they are. So for A, it's they're alert, they're making eye contact with you, they can have a conversation with you. For V, it's they respond to verbal cues. P is they respond to pain. And U is they are unresponsive to any sort of stimulus. And then if they're conscious, just kind of check their level of consciousness by asking them who they are, where they are, maybe what time it is, or when the event occurred, and then also the events leading up to the injury. And then next thing you're going to do is assess their airway. Just make sure that it's clear and if they're having any problems with it. And then also assess their breathing. Just kind of check for rapid breathing or really shallow breathing. Check to see that they're doing okay. And if needed, initiate emergency oxygen. And then another thing you're going to do is check for circulation. So assess and control any major bleeding that's going on if they have an injury with that, and then manage that. Also manage shock. If they're going into shock, try and avoid that if you can. Also check for a pulse, assess their skin characteristics, like make sure they're warm, dry, and red. And then also check for capillary refill, because I feel like mine is never good. I have terrible circulation. But if you pinch it and it goes white and then it goes red again, that means they have good capillary refill. Then the next thing you're gonna do is kind of just do a rapid scan of the body, checking for any injuries or blood or deformities, depending on the situation. And then at that point, you're gonna make a transport decision, deciding if you wanna call an ambulance or some other form of transport to get them to a hospital. At this point, you're gonna go ahead and try to get their history, maybe get a sample history. If they're conscious, great, you can ask them. If not, try and ask like a bystander, or if they have tags, sometimes they'll have like a necklace or a bracelet. And if no one else was around, just try and get in contact with any family that you can to get this sample history. But the sample history includes signs that were going on before or during this event, any allergies they could have, any medical history, pertinent medical history for this situation, any medications they're on, the last thing they ate and when they ate it, and then the events leading up to the trauma. And then once again, you're going to reevaluate for transport, see if after learning some of this stuff you think they really need that. Because if they don't, it's better not to have them come. The next thing you're going to do is a secondary assessment. And you'll start out by obtaining basically some basic, the baseline vital signs, such as blood pressure, pulse, respirations, any weird lung sounds, check their pupils for dilation, their size, make sure they're equal and they're round, and then you're going to check their blood sugar as well. Then you'll go through a detailed physical exam, and with that, for each section of the body you go through, you're going to do, I don't know if this is really how you say it, but I say decapitalis. It's an acronym, and just expose each of those parts of the body to check for injuries. So decapitalis is you're checking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. So you'll start in the head, and you're going to inspect and palpate the scalp, check for like any of those decapitalis. Assess the eyes and the pupils like you did before. Assess the facial area, just check it out. Specifically like the mouth, nose, and ears. Then you're going to check the neck, inspect, make sure there's no weird swelling and there aren't any tracheal deviations. And then you're going to check the chest, inspect it, palpate it, and auscultate the chest and lungs. And then with the abdomen and pelvis, you're going to inspect the abdomen and the pelvis separately, as well as a verbal assessment of the genitalia. Just make sure that's okay. And then you're going to move on to the extremities, like the arms, legs, hands, and feet. So assess each extremity by palpating and just assessing the skin characteristics there and like circulation and stuff. And then if you can, if they're able to with your cervical spine, you're gonna check their back as well. So you're gonna check their thorax, which is the upper part of your back, and the lumbar, which is the lower part of your back. And then at that point, you're gonna manage any secondary injuries that you found while you were performing this secondary assessment. And if needed, you can splint them. And then at this point, you're gonna reassess them for the primary assessment, check their airway, breathing, circulation, etc., and get their vitals again, and treat any changes that have occurred, and just continue doing this until any advanced medical personnel arrive. Anyways, that is it for a patient assessment of trauma. Anyways, thank you so much.